Okay. Dr. Noor, can you allow me to share? So first of all, the aim for this station is to assess the candidate ability to take a focused developmental history, undertake an assessment around the key area of development, integrate this finding to understand the reason for the child difficulties, including the impact of the child and family. So in this station, it is more than likely that the scenario will be based on the child with an established diagnosis. So most likely it's non-diagnosis. It is not hidden, the underlying diagnosis. Relevant information including chart, photo, short audio or video clips will be provided where necessary. The universal cues related to the scenario, either video, audio, will also be provided prior to the start of the station. And if the candidate doesn't understand the task, they can ask the examiner for clarification. So the examiner will listen and observe the candidate take the relevant history. Once the candidate summarizes the key point obtained from the history, the examiner will ask the candidate to describe the process of focused developmental assessment, during which the examiner may inquire about the finer details of how this would be undertaken. Share the findings as dependent cues and clarify any issue related to the interpretation provided. So the candidate expected to discuss the implication of their finding and the management plan with the examiner. And then the examiner will assess the candidate ability to make appropriate use of toys and other equipment for their assessment. So the equipment, it should be, they will provide a photo for the equipment, and you have to select your items before starting the assessment. So when doing so, being able to share with the examiner what information is being sought will give the examiner confident around the thought process, contributing to development. So if candidate has reached to the end of the history taking with a role player prior to the end of the time allotted for this, the examiner will check that they have finished and also ensure they understand that they can move to the next, but they cannot go back to the history. Clear this point? So if you did with the history earlier than the time, you can proceed for the examination, but you cannot go back for the role player. So the candidate will be presented with one or at most two area of developmental assessments. Candidates should be expected to assess development in children between 0 to 5 only. This is the developmental age, 0 to 5 years. They will not go beyond that. And the estimated developmental age should be supported by evidence of age appropriate skills which the child can perform, and the observation that the child is. So I understand that the developmental age will describe it only by the examination, not by the history. It's not written clearly, but anyone is sure about this information I have, that with the history will not give the developmental age by history, but only for the specific task. So we'll ask about it. And the other point that we will not ask about any detailed history about the specific task which were given. But I want from anyone to confirm this information, that during history summarization, we will not give a developmental age.
Yes, I think you are right. As Dr. Abla Alfi, in her last meeting, she confirmed like this. If your
Yeah.
task to check gross motor, you will get history about everything except your task. And you can't give age by history only.
We will not give the age by history.
Yes, true.
Yes,
You
for
have
the
to do the
history, just to
examination.
tell
Once
is
it
it
is complete,
global developmental delay or isolated only.
Yes.
Okay. So the candidate should be competent at assessing any area of development and should be able to decide whether the child should have further therapy or investigation, whether the child simply need observation over time, or whether the parent can be reassured. So with the with the management, so either reassurance or escalation and referral. So candidates should be demonstrate the skills and knowledge expected of the trainee ready to progress into level 2 trainee, but not necessarily one who has worked extensive in the child development center.
okay. So do you want to tell about the timing of the station now?
Yes, yes. So this is the timing. So in the first 4 minutes, the candidate, this one actually for this timing given for the online exam, but it's the same even for who's going to the face to face. I think except for this 5 minute total. So 1 minute for extra for the vigilator and so in the first 4 minutes, the candidate will enter the station and to read the information, to see the universal cues, and for preparation. Then in the first 10 minutes to take a focus history, and there will be warning at 4 minutes remaining. Then 2 minutes for the summarization of the history, and then 8 minutes. So it will be 6 minutes for the assessment and 2 minutes for summarization, then 3 minutes for the discussion with the examiner about the investigation and management.
Dr. Ola, sorry to disturb you.
Yes.
What is this PDF, please? Can you tell us?
What?
This PDF?
This
Where I will
PDF?
find? Yeah,
This one
yeah.
description of the stations. It's
Okay, in
from,
the RCPCH, right?
yes,
RCPCH
from the
description
website.
website. Okay,
Station
thank you.
description and the flowchart.
Chat. Okay,
Okay,
thank you.
Dr. Ola, please share us in the group later, huh?
Okay,
Oh, okay, okay.
thank you.
So that we can all see it and read it.
Mm. So, okay, the important, this one to meet standard. So the important need to explore the main problem concern of the role player in a structured manner. And in the physical examination, it should be well structured, systematic exam technique verbalized, appropriate recognition of the requirement of care taken to the adapted to need of the patient, including permission to examination, appropriate use of equipment, developmental toy, and I will show to you the picture also in the website. Identification of clinical signs that are present, correctly interpret clinical signs that are present. But also, it's an important point that it's written that they can provide with the neurological or syndromic child, but it is not necessary to identify this specific syndrome. Just to describe the dysmorphic, which are this one, see. Scenario will be based on the children with mild to moderate developmental difficulties who may or may not have an associated syndrome or neurological abnormalities. Where there is a syndrome or neurological abnormalities, this should be noted, but the aim of the station is not to undertaking detailed identification of the dysmorphic feature or assessment of the abnormal neurological signs. Okay, then clinical reasoning and to formulate proposes likely appropriate differential diagnosis, understand implication of the finding, able to suggest appropriate steps if exam inconclusive, and management it should be relevant investigation to appropriately address identified problem, to provide safe, ethical, effective management plan that related to parent concern, including appropriate referral or escalation. Then communication skills, rapport and communication style. It should be appropriate level of confidence, greeting, introduction, professional, sensitive, appropriate body language, respond to verbal and nonverbal cues, and develops appropriate rapport with the role player, puts at ease, and clarify role, share agenda, and appropriate tone and pace.
Okay. So now you will show the toys.
Yes, a minute.
Okay.
So this child developmental assessment material, this one checklist. So the item, the wooden cubes, laces, cotton reels, toy cups, toy saucer, teaspoon, insert a board, wooden big puzzle, toy animal, toy cards, crayon and some paper, small sponge ball, picture book, safety scissor, brush and doll. I will show the picture. So this is the picture. So it will be a toy cup, spoons, picture book, scissor, paper, crayon, wood puzzle, doll, brush, cubes, thread and ball, animal, toys and cars. Okay. So before starting of the session, you have to select appropriate toys.
Okay, this picture is from the website, huh? It is in
Yes,
the website.
yes, it's from the website. Okay, then we'll go for the scenario.
Wait, our candidate is there or not? I will check. Dr. Krishna, you are here? Hello? Dr. Krishna, please unmute if you are here.
Hello? Hello?
Ah, yes, yes. Okay.
Sorry, I got a call. Sorry. Yeah.
Okay, no problem. Now you are free.
Yes, yes.
Okay, now she will give you the scenario. And what about the time? Tell me, Dr. Ola, again, how much I should set the time first?
Yes,
10,
first of
10.
all, you will set it 10 minutes. It will be 6 and 4.
No, but for the scenario, you will give 5 minutes now, sir.
For 4 minutes for preparation. So
4
now, yes.
So you give, and after 4 minutes, then I will keep 6 and 4 minutes. Okay.
Yeah.
Then
Yes.
2 minutes for summary, right?
2 minutes for summarization. Yes.
Yeah. Then again for examination.
8 minutes. Then 3 minutes for discussion. 10 to 8:03. Hello?
So after 6 plus 4 for history, 2 minutes for history summarization, right?
Yes. Then
For
8,
clinical
8
examination.
minutes. 8 minutes, then 3 minutes for discussion.
Okay, 8 minutes. And again, I think there is 2 minutes
3
for
minutes.
summary
3.
of the
3
So
minutes for
6 minutes,
discussion.
6 minutes for
summary.
examination and 2 minutes for summarization.
Mm-hmm. See,
I
this
think
is
it's
which will be provided in
10
the
to
exam.
8:03. 10 to 8:03.
Okay.
Yeah, so
Okay.
first 4 minutes for preparation, then 10 minutes for the history, and 2 minutes summarization.
Okay.
Yes, 8 minutes for the examination, then 3 minutes for discussion.
Yeah, in the 8 minutes, 6 minutes for examination and 2 minutes for summarization.
Yes, yes.
Okay. Fine, I will keep the time, no problem. You can start.
Okay.
Okay.
So what? Okay. Yeah.
Did you start it?
Okay. Shall I read the scenario regarding
Yes,
Lucy?
this is,
4 year.
yes.
Okay.
Yes, your
Concern
4
about
minutes starts.
Try to read it,
Yeah.
and yes, within 4 minutes you will read the scenario.
Yes.
Prepare yourself.
Okay. Lucy,
And did you see the photo? This is universal cues. I give it.
yes.
Okay.
Yes. So I want to examine the gross motor milestone of Lucy, who is 4-year-old. Okay. And I
Yeah.
have seen the universal clue. Yes, I can start. Okay.
We will go like the scenario. Take your time. Once the time finish, you will start. Okay.
Okay, fine. Yeah.
So 20 seconds left now. Next, I will keep 6 minutes. Okay, you will start history as soon as the bell rings.
Yes, yes.
Okay. Yeah, at 6 minutes, you will be reminded again. Okay,
Yes.
you can start now.
Okay. So yes. Then Lucy's. I'm talking to Lucy's mother. Okay. Yeah.
Yeah.
Good afternoon. Good afternoon. The name was not given.
No, I know.
Sorry.
Anna,
Okay.
mom of Lucy.
Okay, Anna. Good afternoon, Anna. I'm Dr. Krishna, one of the pediatric registrar working in the hospital.
Good afternoon.
Yeah. Would you mind if I take some notes regarding Lucy's condition?
Yes.
Yeah. So, can you please describe what is your main concern regarding Lucy?
Yes, Dr. Lucy, she is delayed and everything. She's very slow in her skills.
Oh, sorry to hear that. Since when this problem started?
Yes, I noticed since beginning.
Okay.
She's slow I see in everything she's happy.
Okay. From the birth, it was detected, and it was detected by doctors, or you only detected and raised the concern?
Um, yes, doctor, you know she has a Down syndrome.
Yeah, because the facial features are typical that of the Down syndrome. So it was detected since birth, and then was assessed by doctors. Is it so? For
Yes, yes.
yeah, okay, okay. Then I would like to know whether Lucy was kept in an ICU after that, or was there any problem associated with him, like any emergency?
Yes, doctor. After birth, she has a difficulty in feeding. She's slow in feed. So shifted to Nico, and
Uh-huh.
they inserted nasogastric tube for her.
Okay, and for how many time they kept Lucy in the NICU?
Almost 2 weeks.
Oh, sorry to hear that. Apart from this, does Lucy face any problem in the NICU
After
apart from
birth,
feeding?
no, no.
Okay, so can you please tell me when did the Lucy startled by if there is sudden noise, he get startled. So the normal child, they get startled to the sound. So when Lucy started doing that?
Maybe 3 months.
Okay, and when she has started turning to the sound?
Almost same 2.5 months.
Okay, and when she has started babbling or recognizing mother's voice?
Almost she can recognize me 8 months.
Okay, sorry to hear that. And when she has started imitating the sound?
Uh, maybe at one year and 8 months.
Okay, and when did she started response to his own name, her own name? Sorry.
where they are tested in each of the exam stations. So where there's a red X,
Hello.
that the fact is tested in that
Dr. Nur,
station.
can you hold the
And
time
you can see
from this time?
here just
What?
quick observation.
Can you hold the time? I
Identify
don't.
Okay, okay.
science. This is tested quite frequently, as is clinical reasoning, and as
Okay, I paused the time.
communication style. Other domains or other core skills are not tested as often, but they are, or they do tend to come up in stations which are either longer, such as development and history, where there are opportunities to take histories and gather information, or some of the more subtle skills that are.
Okay. Where is Simba? Sorry. Okay.
Hello.
Can you
Yes,
resume
yes,
back?
yes,
Mhm.
yes.
Yes,
So
doctor.
yeah,
She has she imitating sound. She's not very good to do that.
okay. And does she understand respond to own name? Like if you call her, then does she listen?
Yes, she's responding.
Okay. At when she started responding to her own name?
Maybe 18 months.
Okay. When did she started saying like mama, dada, like this? Approximately.
Almost 2 years.
Okay. And does she can say a simple sentence like 2 word sentence?
No, she started to say two-word sentences.
Okay. What about when did she started smiling?
Smiling, no, since early, maybe two to 3 months.
Okay. Okay. When did she if anyone new person comes in the does she gives any unusual stranger anxiety to them? At when did she started doing that?
Maybe 15 months.
Okay. If
6 minutes
had you
finish, 4 minutes left. Okay.
okay, yes. When did she started playing peekaboo or saying bye bye?
18 months.
Okay. Uh, when did she started this indicating the need? Like not by crying, like normally, like if she wants something. When did she? Yeah.
Yes, almost 2.5 years.
Okay. 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 So okay, fine. So do you, what about her hearing and vision? As I can see from the picture, there is a she had a glass. So what was like when she was detected with what problem she's facing with vision?
Yes, she has a refractive error and also nystagmus.
Okay.
Sorry, she has deviation of her eyeball.
Okay. Okay.
And
Uh,
refractive error. She has weakness in her vision.
okay. What about hearing?
Yes, also hearing test. She didn't pass the hearing test after her birth, so we are still following with the ENT.
Okay.
We are
So
frequently checking her
so
hearing.
are you using any hearing aid or something?
No, but we are following with the speech and language
Okay.
therapist.
Okay, fine. What about her dressing? Can she remove simple things like um, uh, 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 a t-shirt or something?
Yes, she's
Okay.
removing, but not. She's unable to unbutton.
Okay. She's unable to unbutton. Okay.
Yes.
Okay. What about the toileting? She achieved dry by day. Like she gets dry by day. Like
I started her. I start training her, but still, she's depending on me. She
okay.
required more training.
Okay. Does she can for eating? Can she use for?
She's using, but it's difficult for her.
Okay. Okay. Uh, okay. Fine. Uh, then I want to know the birth detail of after that, like 14 days for the feeding. After that, was there any admission after that?
No,
Okay. And her this Down syndrome was detected antenatally or it was detected after birth?
no. After birth, when they saw her, there is a new dual feature for her. They did
Okay.
some blood test, genetic testing, and they confirmed the diagnosis of Down syndrome.
She is your only child or you have another child?
Yes, this is my first child.
Okay. If you don't mind, can I ask your age and your husband age?
My age 42,
Uh-huh.
and my husband almost 45.
Okay. So can you please provide the family detail? Are you a relative?
No,
Okay. And how about the his diet? Like, how are you managing the diet? Of you said for 14 days she was admitted. So after that, are you following with any teams of doctor?
yes, we are following with the speech and language therapist, and she has this one feeding difficulties all of the time.
But
We
never
are
got
following with
admitted.
dietitian.
But she was never got admitted, right?
No.
Finish up for time.
Okay.
Okay,
Any
please.
invest? Okay. Okay. So I didn't. I take the mother of. I take the history of Lucy from her mother, and like according I discussed, she's 42 years, like with the only child, and like they are. Uh, she's all the domains. I asked for the history for social language, for speech. So she's delayed in almost all the domain. I would like to examine her globally, as the features are more suggestive of the facial features are more suggestive of the Down syndrome. And she has a uh, for vision, she's following with the ophthalmologist, and she's wearing a glass, and she's also following with the ENT doctor, but not using any hearing aid in the picture and when I inquired from the mother. Otherwise, she's following with other teams of doctor. So I would like to examine him in all the domains.
Okay, proceed for examination.
Okay. So Lucy, hi Lucy. Can we play together?
She's
I will
fine.
ask. Okay,
Yeah.
okay. Yeah. So can you walk forward for me, Lucy?
Okay, she's walking.
Okay. Can you walk backward with me?
See, you are describing what you are doing to the examiner.
Yeah, I will walk backward. Yeah, I will walk backward, and with the like I will ask, can she walk backward?
Yes.
Can she walk sideward if I ask her to do?
Yes, she's able to.
Okay. I will ask if from the if she can walk forward tandemly.
No.
Okay. Then can she run smoothly?
Yes, she can run, but sometimes she's falling down.
But she can run smoothly, right?
Yes.
Okay. Can she run on tiptoe?
No.
Okay. Can she jump at place?
Yes.
Can she jump forward?
It's for short, for one.
Okay. Okay. What about hooping? Can she hoop?
No.
Okay. Can she stand momentarily for 1 second on one leg?
Yes.
Okay. For 5 seconds?
No.
Okay. Can she, if I give her, there is a tricycle near, can she ride it?
No.
Okay. I will give Lucy the ball. Can she able to kick
Yes.
while running?
No.
Okay. I will give the Lucy ball in the hands. Can she throw the ball out with outstretched hand?
She's throwing the ball, but not over the head.
With outstretched hand? No, no. Over the head. Over the head, she can do?
No, no, no.
No. No. In front of chest?
Yes.
In front of chest, which she can do?
Did you mean catching?
Yeah.
No.
Okay. Throwing in front of chest? She can do?
You mean catching?
No,
Front.
throwing in
Okay.
front of.
Throwing. Yes. She's forward.
Okay. In front of chest, she can do throwing. Okay. Can she? She cannot. Can she? Can she catch the ball in front of chest? No, she cannot catch. Right?
No.
Okay.
No.
Yeah. If there is stairs surrounding, I will ask Lucy. Can she go in adult manner upwards?
Yes.
Okay. Can she go in adult manner downward?
No.
In child manner she's doing. She's going down in child manner, right?
Yes.
Okay. Okay. Fine. I finished my examination, and I would like to
Okay.
complete.
Present
Yeah.
your findings.
Yes. I have examined Lucy. She can, in most of the, I was asked by the examiner to examine Lucy for the gross motor milestone. So in most of the domains, she's falling in the gross motor range of around, I would say, 2.5 to 3 years. And because I have done most of the tasks she can do in the gross motor is 3 years. But in other domains, like when I took the history, she was able to do in 2.5, around 2.5 to 3 years. Otherwise, her features are suggestive of the Down syndrome. There is a global developmental delay, and she's following with the team of doctors. So I would like to involve my consultant
So
pediatrician.
before any investigation, you want to request?
She's already a diagnosed case of Down syndrome, right? So I would like to do a formal visual assessment. I would like to do the hearing assessment. I would like to do, if not done previously, the thyroid function test. Then I would like to do. I would like to. First of all, I would like to complete his examination in terms of fine motor, social, and language. Then I would like to do the as already done but not needed chromosomal analysis, and then ophthalmologically and audiology assessment. Then uh, if required, I will involve my consultant, and then I will uh, I will involve the orthopedic surgeon also. Yeah.
What are the causes of global developmental delay in child with Down syndrome?
Causes of global developmental delay, it's a genetic cause. So trisomy 21, because of this, it causes the delay. So she's delayed from the birth. and her delay was noted. It's not a neurodegenerative type of the disease, so because of the genetic makeup.
And particularly for the gross motor delay, what is
Hypotonia.
Mhm.
Hypotonia. Yes.
So how you are going to deal with the mother concern?
Yeah, I will first consult the mother. Though they are very delayed, but yeah, we can achieve. They can have a good life span and good quality of life with the if we follow with the multidisciplinary approach.
What's the multidisciplinary team you want to involve?
The consultant, the physiotherapist, the occupational therapist, speech and language therapist, education psychologist, audiology, then ophthalmologist, genetics, then health visitors, and school teacher.
Okay. What is the role of a speech and language therapist
Occupational
in
language
this
therapist.
Now
patient?
3 minutes left, huh? Last 3 minutes are left.
Occupational therapist will help in her day-to-day activities, like she will help how to do her dressing and dressing, like with the with her day-to-day activity, and she will help the family to how to deal with the situation. So she will help in assigning the school, and will help in Lucy's development, like this. Hello? Hello?
What's the other intervention she may require? Particularly, what
Your voice is not clear to me. Hello?
may require?
What
Sorry?
other
Hello?
intervention is required?
Yes, what are other interventions are required? Is
What's
this
the possible surgical intervention the Down syndrome required, regardless of this case?
okay? They can have in the later in the life they can develop cataract, and they can develop congenital heart diseases. So they can develop later. It can be detected like atrioventricular septal defects. Then they can develop intestinal obstruction. Then they can have the developmental joint subluxation and developmental dysplasia of the hip. Hello? Hello?
Just wait, let us see. Maybe there is some problem in her mic. Hello, Dr. Ola. Have passed the time. 41 seconds are left.
Hello. Yes, I'm disconnected.
Continue.
Yes,
Yes.
yes.
Can you repeat? You mentioned congenital heart disease, cataract. What
Mhm.
else?
They can develop intestinal obstruction. They can have a developmental dysplasia of the hip. Uh, they can have a yeah. These are the major conditions they can have for the and atlantoaxial dislocation.
Mhm. Okay. Still there is a time?
Yes, because he had told all these things, so I had paused. There is 30 seconds now.
Okay. What's the recurrent risk for the Down syndrome?
Recurrent risk, it all depends on what type of we need to do the genotype. If it's mosaicism, it is the most common, then it is less than 1%. If it is translocation, maternal, 21-21, irrespective maternal
Are you
paternal,
sure?
it's 100% fatal. If it is maternal, 15-21, say from the different chromosome, it's 5%. If it is if it is maternal, then 10%. If it is paternal, then 5% chance if translocation is there. But 21-21 is fatal. And then mosaicism is the most common, I told you, which is less than 1%.
Okay, time finish. Time finish.
Mhm.
Okay.
Okay. Good trial, but I have comment. During the history, I think you missed a lot. Um, I think your approach for the taking the history for other developmental milestone, you are wasting your time with the previous milestone. So I think better to start with the what she can able to do now.
Okay.
This one, so you know she's 4 years. So by this moment, what's the skill she's able to do now?
In terms of gross motor, you mean?
No. Gross motor, you will not ask about
It's a,
gross motor.
the story. She can tell story. She can
Yeah,
be,
so now this
yes.
speech, what she can say now,
She can,
instead
yeah.
of what she's doing in the early neonatal period.
Mhm.
So by now, you know her chronological age. So now, what she's able to say, is she able to tell a story? So you will start with the
No.
expected in this
Uh-huh.
age, and if it's delay, you will go backward.
Okay. Uh-huh.
Okay. For all speech and language, for fine motor. I didn't hear did you ask about anything about fine motor?
No, fine motor, I didn't get time only, so I could not ask about the fine
Hmm.
motor.
So just
I could,
to ask
yeah.
two to three questions maximum for each domain. So now, is she
Yes.
able to draw a man? Is she able to draw a circle like that?
Okay,
And for
Dr.
the
Ola, just
social,
one
you ask
minute.
about the dressing, toileting, feeding. It's okay. So first of all, you ask about the main concern, then the developmental milestone, then we'll start with the birth. During pregnancy, any issue during pregnancy, what's the mode of delivery, term return, admitted to NICU, for how long you ask about this, when she's diagnosed, by what, and screening test. You didn't ask about any cardiac, any echo done or not, any, they are checking for thyroid or not, have ultrasound. Is she now on any chronic medication? Maybe she's on thyroxine now. Any surgical, any cardiac surgery done? Is she on medication? And the team
Yeah.
involved, you ask about the vision and hearing. It's okay. And the team following. Okay, you mentioned the ophthalmologist, speech and language therapist. Is she involved in support group, social support, any financial issue? You didn't touch the social environment. How's the impact of this on her and on the family? And the during assessment, first of all, you have to say, I will introduce myself to the Lucy, and for take permission, I will observe what she's doing now. Will observe if she's dysmorphic feature. Will take a growth parameter, and we will select the toys which provided with you before starting. Maybe in the gross motor, maybe you will select the ball, and I think this one. So for also for your assessment about gross motor, it's okay. You're starting with the how's it walking, standing, running, the ball. For the first of all, how was she throwing a ball, catching a ball, and bounces?
Yeah, she was not able. I didn't ask for bouncing because she was not able to do earlier tasks.
Yes, yes. But
Yeah.
I think for the throwing a ball, if she able to throw, this is 2 years. If she's throwing a ball overhead, this is 4 years. I don't know what do you mean by throw a ball out stretch hand. This
Okay.
one for catching, which I know catching a ball, either front outstretch arm going with the 3 years, up outstretch arm 4 years, and the front of the chest for 5 years.
Mhm. So she was not able to do catching in front of the chest and throwing above the head. She was not able to do both the
Yes.
tasks.
Mm,
So both the tasks were advanced. So I lowered down and I
mm,
didn't go with the bouncing and all. So
mm,
she was able to do the task at 3 years in
mm.
ball also.
Yes. And you ask about the kicking a ball while she's running? It's no, not. Okay, so also you can mention, but although there is no stair in the examination room, but I want to explore how is she going up and down the stair. And also for the tricycle, I know there is no tricycle, but I want to explore how she is she able to ride the tricycle, and is she able to be the maybe she's only sitting on the tricycle, but she cannot pedal.
Hmm.
Okay, again for the discussion. What are the causes of global developmental delay? You mentioned underlying genetic basis, and can be delayed in cerebral maturation, can be associated with the structural abnormalities. You mentioned for hypotonia for the gross motor developmental delay, hypothyroidism. It's usually associated with the global developmental delay. Perinatal event, it can be perinatal asphyxia. Underlying chronic condition, like if she has congenital heart disease, and then she's in heart failure, maybe
O-
this is underlying cause of
Okay.
developmental delay.
Okay. I thought you are asking in this particularly in Down syndrome. What is the cause? So that is why I
Yes, no, in Down syndrome.
Yes, yeah, I thought you are asking specifically in this patient what is the cause of delay. So that is why I stuck to genetic cause
Oh.
only.
Mhm.
In general, yeah, there are many causes like apart from taste, sex, send offs. GM1 gangliosidosis, then Zellweger disease, like this, and any trauma, tumor, infection, metabolic causes, phenylketonuria, like this, and
No, no,
other
no. I'm
genetic.
asking about global developmental delay in Down syndrome patients.
In Down syndrome, no, I don't know, like in particular to this.
So in Down syndrome, yes, there is underlying genetic basis in Down syndrome. And
Mm-hmm.
with Down syndrome, they can have a delayed in cerebral maturation
Oh, okay.
and can be structural abnormalities in patients with Down syndrome, hypotonia,
Yeah.
hypothyroidism.
Yes.
Also, they are exposed, maybe they will exposed to perinatal event like any patient, like any baby.
Yes.
And underlying chronic disease in Down syndrome, like maybe unoperated, uncorrected large AV canal. So they will have congestive heart failure. So they predispose to the developmental delay.
Yes. 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 I got it. Yes.
Okay, and the management. Also how to deal with the concern of the mother. She needs global and formal developmental assessment by development center, and she required educational healthcare plan. She required the multidisciplinary team you mentioned. The team also can including play therapy, community pediatrician, social support group, respite care. And the role, they can ask you about any role of member of the team. So the role of a speech and language therapists, they play a great role in improving the expressive and receptive language progression. They work together with the parents. They can guide a parent how they help a child in daily activities, communication, interaction with other children, and they can improve the oromotor, lip movement, tongue movement, and improve articulation. And if still she having a problem with the swallowing, they can assess the swallowing function by video fluoroscopy, and they will give the advice. And I ask you about the possible surgeries. So you mentioned cardiac surgery, cataract, GI surgery, like tracheoesophageal fistula, Hirschsprung disease, duodenal atresia, also for atlantoaxial subluxation, adenotonsillectomy. What else? Can be with the recurrent otitis media with effusion. They may require grommet. They may have also hydrocephalus, VB shunt, if associated with anarchiary malformation. Okay. Mm.
Yes.
So if anyone has comments,
Yes,
feedback.
Dr. Lata. Yeah, I have a few questions to you. Okay, this was very nice presentation, both of you. Thank you. So my question was, Dr. Krishna asked that she was diagnosed when she was admitted in an ICU, right? So
Mm.
I think we will not give like this type of leading question, right? We will ask mother open question that how he was diagnosed Down syndrome. Is there any special test done? So mother will tell yes, they did translocation or they did the genetic testing. or they did the karyotyping, or yes, the mother will say in layman term they did the genetic testing, because the first question of examiner will be how the patient was diagnosed Down syndrome. Okay, maybe I'm not telling that it is a must question, but it can be one question. Okay, so this is one point. So I cannot ask leading question, right? Like
Mm,
this. I have to ask how, open-ended question. And as the developmental station is not like general history taking station, so here are few important points according to me. That is, in developmental station we have to ask more open-ended question rather than closed question, because it is a only 8 minute station, right? So we have to ask like, do you have any concern? First question, do you have what concern you have? So mother will tell, my baby is Down syndrome, and my baby is very slow. He cannot eat properly. He cannot talk properly, like this. Okay, so mom, can you tell me how he was diagnosed Down syndrome? Bas, stop. I will stop here. Then mother will tell, yeah, he was admitted in a NICU, then he did blah blah blah. Okay. So this was second question. I think we hardly we can ask 8 to 10 questions in developmental history, and it should not be haphazard, because here what I felt, Dr. Krishna said many times about the sound, name, startling reflex, babbling, recognizing moms. These are all less important question than the open-ended question, right? He took a lot of time in this question, so important time he lost. And because he did not ask about the mother's main concern, he did not ask about the social issue, impact of the disease on the family, impact of the disease on the child. He did not ask the multidisciplinary team involved, what is the other comorbidity of this child. So these are the main problem in this child. So Niku, how many days he asked? Yes. So birth history is very important. Any mom, can you describe the birth? Before birth, after birth, I mean anything, just describe me. So mom will tell that it was okay, I was okay, no problem, my baby delivered normal vaginal delivery, it was everything okay, but my baby is admitted in NICU for 4 or 5 days, all the tests are done. Mom, can you describe how many tests are done and what are those tests? Yes, genetic testing done, echo done. Mom can tell because this is Down child. So thyroid function done. Okay mom, is there any, if mother did not tell you about the thyroid function, you can say, mom, do you remember thyroid test done or not? Mom said, no doctor, I cannot remember. Okay, how many can you describe how many medication your baby is taking now? Medication history is very important here, because I don't know the baby has Down syndrome or not. Sorry, thyroid or not. Okay, echo, is there any he's getting any cardiac drug or not? So medication history is very important, that Dr. Krishna missed, I think. Any other problem, mom? Okay, this is another past history. And regarding the developmental history, it is a gross motor station. So I cannot ask anything about gross motor, like cycling, walking, running. I cannot ask anything because it is a gross motor station. So I have to ask from fine motor, because motor including two components, gross motor and fine motor. So Dr. Krishna wasted a lot of time on bubbling sound, that is the speech area. He did not ask about the fine motor. So you have to ask about the fine motor, that mom, now what type of activity he can do by hands? Ask open-ended question. What kind of activity he can do by his fingers? Because finger is the fine motor, right? So ask like open-ended question. Mom will tell, yes doctor, he can use the spoon, he can use the cup. Okay, can he use by both hand, spoon and fork, or spoon and knife, like this, both hand? So mom will tell you like, fine motor, one question, enough. Then go to vision hearing. Mom, do you have any concern about vision? Do you have any concern about hearing? Okay, is there any special test done for hearing or vision? Is the baby is using spectacle? Is the baby is using a hearing aid? These are very important questions regarding hearing and vision. Then come to the speech and social and language. So mom, what type of language you use at home? Okay, English. Okay, then how can he communicate with you? Full language, I mean how far he can say. So mom will tell, yes doctor, he is using full language with us, he can complete the sentence. Okay, can he play rhymes, nursery rhymes? Yes, he can play, because down child, we know they're fond of music, they're fond of, rhymes, nursery rhymes, so they can easily tell you nursery rhymes. This is another important point. So this is speak, okay, speech. If the baby is now, if baby now telling you about the rhymes, no need to go to babbling. Maybe he was delayed before, but not now. He's a 4-year-old kid and he can easily say rhyme. So no need to go backwards, because even if it was delayed, it is okay now. So we don't have to explore the back history. We have to explore the now history. Okay. So this is one important point. Smiling, he asked about smiling, recognizing mother's voice. This is very, very past history. We will not ask here. We will ask what the baby can do now. Okay. If mother say no, he cannot speak. Acha, mom, did he did he startle when you see any sound, or did he smile? Then you go backward like this. Okay. Then
Yeah,
social.
I
Okay.
yeah, I agree to you this point, but this detailed history is important in case of neurodegenerative. So in not in this case, but in general approach, where the problem started. Does she was delayed from the birth itself? So all the milestones were delayed from the birth. So there is some congenital disease. If the milestone has since 2.5 years it was delayed, and then it was all of a sudden has happened, then there is some incidents has happened, like some infection, for example meningitis, or like this, or some genetic diseases has come like DMD, which appeared later. So to divide the group of diseases, because I attended a course, so they said like you have to ask where the problem started. Was it from the birth itself? Was it started? So you can tell that it's a genetic or a neurodegenerative disorder, or if it's all of a at a particular point, then you can go with the infection, trauma, tumor, hemorrhage. Something has happened at that point.
I agree with
So
you. I
yes,
agree with you, but this is not a neurodegenerative disease history. That is you are
yes,
saying, that is you are saying regressive. I agree.
yes,
Regression is different thing. Where the regression started, like Landau-Kleffner, there is a speech regression. Like SSP, subacute sclerosing panencephalitis, like Wilson disease, they have developmental regression, neurodegenerative, you are saying. But this
yes,
is a
yes.
clear case of Down child. Okay, we are not going now for neurodegenerative. That is different issue. That diagnosis
Yes.
is different. That history is
Yeah,
different.
no. I'm in general. I'm talking, not
Yeah,
particular
yeah.
to this case. Yes, yes, yes.
Let us stick on this case. So when any child, they will ask you about the development, that so particularly the child does not have neuroregression. You have to go first, what can he do now? Then backward, go backward. If the mother say the child cannot speak, then your history comes. Okay, mom, what can he do from birth? Did he smile? So now you start from the birth. But mother says he can speak. So that means there is no problem. And as we cannot ask about anything gross motor, so we will skip here. Social, toileting you can ask, because toileting history you have to ask. Dry by night, dry by day, both important. And also toilet, because down child may have issues with intestine. So you have to ask about the toileting, that what is this self-toileting, or you help him. Okay, button unbutton, not so important. Ask mother what can he do with the fingers. Mother will tell you, because you need more open-ended question. Here only 10 question you can ask. Every question is important. Every question, because it is a 8-minute station. It is not a 13-14-minute station. Okay, you cannot waste your time like this. Okay, so relative marriage, yeah, marital history is very important, because a consanguineous marriage also, like translocation, if there is history of family history of Down syndrome. You did not ask family history of Down syndrome. That is very important, because translocation. Okay, family history of Down. I actually wrote your points. That's why I can tell. Then diet. You did not ask about the diet. You did not ask about the immunization. Very important. Okay. You did not ask about the surgery done, like Dr. Ola said, grommet insertion, DDH surgery, many surgery can be done. You did not ask any surgery is done or not. So relative marriage, family history of Down, diet, special diet, because they can be have associated celiac disease. Okay, so they are using like gluten-free diet. So you have to ask about the Diet. Any special diet you are, because you know this child can have celiac disease, mother will not tell you. If you do not ask diet, mother will never tell you, and the examiner will ask, what is this child diet? And you'll say, I did not ask. Actually, this child has a celiac disease associated. Then there'll be cut off mark, right? So special diet, very important. Any surgery, very important. Any chronic medication we discussed. Any home modification you did not ask. Any home modification done because this child may have DDH. So they are shifting to the first floor. Any support group you are, because you know this mother has many concern about the child is not growing properly. I don't know anything about Down syndrome, doctor. So ask about the mother's concern and support group, social impact of the disease, and in financial DLA. You did not ask about the DLA. Okay, disability. They will get disability living allowance. Okay, these are main point. And another most important, last but not the least, what is that? That is, mom. Do you think, mom, do you think any point I did not ask that is important for your child? I did not ask. This question is very vital in history taking. Okay, because mother will tell you, yes, doctor, I have a concern that my child actually we are not taking care properly. What can I do to improve my child's life? That means these parents are actually less counseled. They have less social group, support group. So you have to ask, mom, did I miss anything that is important you want to talk? Okay, this question you have to ask. Okay,
In
these
the
are my,
beginning, in the beginning, by two questions, you can rule out this is uh, regression or this is from the beginning. So just ask the first question what they are asking in UK. They are asking what you brought into today, mom. She will tell you her concern. Definitely, this is the development station, and she will definitely tell that development problems. Then you should ask when did you notice first, or it was in the from the beginning. Do you think this is an open-ended question? So she will tell you each and everything. Yeah, I did notice from the beginning she was not achieving her or his skills, and like this. So this is first two questions. In the first two questions, you will get to the point that that is not a regression or that is from the beginning. Then no need of go back to the birth. After the birth, what was happened, how he started babbling and how he started sitting and how. Then there is no need. You got the point that this is not a regression, and this is from something developmental delayed. Definitely, this is not a regression. Then for the development history, you can start from the age. Like my child is 3 years old. I will start from the 3 years. He can do that or not? Okay, he cannot do. I will come back. Okay, 2.5 years
please mute.
milestones he has achieved still or not? Okay, he did not achieve. Okay, then I come back to the 2 years. He did achieve that or not? Like this, you can ask. If you will
Dr.
start
Rohil,
from the
please
beginning,
Dr. Rohil, please can you just pardon that the question of yours of neuro regression? Which question do we ask for regression?
regression, I was saying that, Dr. Muzna, if you will say that what you have brought into today, like if they are coming in the OPDs, definitely this will be in the OPD. So what you have brought into today, they are asking this question in UK. So mother will tell that my child is Down syndrome and he is not developmentally delayed, and I am quite worried, like he cannot play like others or something like this. So when did you notice, mom? It was from the beginning you noticed that he was delayed from the beginning, or he achieved his their skills, and then he regressed or he lost, like this. Then mother will tell
Okay,
you
okay.
definitely there is regression or not. If there is no regression and this is from the beginning, no need of going to the infant developmental history to take. Then you should start from the history. I don't know. Somebody is interrupting me. So you should then start from the age. Like my son age is 3 years old, and I am quite worried about his development. So I will ask at this particular 3 years age, he can do that or not? No, doctor, he cannot do. Okay, 2.5 years, he can do that. No, doctor, he cannot. Okay, 2 years, he can do that. Yes, doctor, he can do that. Now you have got in mind that he's just 2 years old by the development. Then you should ask other particular concerns regarding the diagnosis. You have Down syndrome, you should ask for the Down syndrome, about the VN hearing and associations, and what multiple disciplinary team have been seen so far, what are the medications. So in the plan you need to tell that maybe he's not taking this developmental clinic, he's not going there. So you have to add the developmental clinic. He is not screening by for celiac disease or diabetes mellitus or something else. You have to add for that, because mother is coming for just not for development. You will address, you will have to tell I will approach for that, and this and other things you will have to ask. I mean to say this. Yeah, definitely you will have to ask about the DLA, because in the UK everybody, even I'm rich but I am taking DLA, this is my right, I will take DLA for my child. So you are taking or not? Definitely you'll have to ask modification of the home, because you are going to plan management for the child, and he will examiner definitely will ask you how will you manage this child, and you will have to tell maybe he needs some modification at the home. He cannot live in the second floor, he want to live in the first floor or something. Maybe he's associated with autism, so may have some behavioral problem. So definitely always took the history which you can defend in your management plan. I mean to say, if you will start like this from the beginning, he can do this that, then you will hardly will reach to the main points of the history. I think so.
Yes, Dr. Rohil said very important points. Dr. Ola, can you say us about how I will tell that examination finding? Like today I examined Sarah. His developmental age is like 3.5 years. How I will tell? Just 2 or 3 lines in, because minutes, 2 minutes, right? 2 minutes this examination finding. Hello, Dr. Ola is there?
Dr. Ola, can you unmute the mic? Hello,
I think,
Dr. Ola.
I think he's not. She's not here. Dr. Noor.
She is here. I see her, but maybe she's not listening to us, or I don't know. And also there were some jargons, Dr. Krishna. You should avoid the jargons. You said antenatally, which I marked. Try to avoid jargons because they will undermark you for this thing, even in the history. Okay.
Yes.
And
And after
even though
exam,
she's 4 years old, we should ask any special nursery that she's going, or what? Why the school was mentioned here?
Yeah, definitely they are starting, Dr. Noor, 3 years. My niece is there, and she was 3 years and she was going to the nurse.
And
So
also
it's like nursery. Even
Yeah,
for Down syndrome
this is,
children, they will have.
yeah. The Down syndrome, even they are saying that they have written in the literature of the Down syndrome, you should start, this is in the NICE guidelines, you should start asking about the from the parents to get an idea of from 18 months to 2 years of age. For the nurseries, you should start to get an idea about he can go to the live mainstream school or not. They are starting, this is they have written in the NICE guideline, particularly for the Down syndrome, what you will do in the follow up. So from 18 to 2 years of age, they have written this one, you will start asking about the school.
Means from 18 to 2 years, they will start going to nursery, and
No,
there
no, they are not start going, you will start asking. So they will start nursery from 3 years. They are starting their nursery from 3 years.
Mm. So in the nursery, they will be assessed whether as a Down syndrome, they can go to mainstream school or they have to go to special
Yeah,
school.
yeah. They are saying that there will be input from these school teachers and the school nurse. They will give the input that in which particular areas he's deficient, and maybe he need an extra class, or he may need to go to the another school, or may he need some extra support only. So they will arrange.
Even if he goes to mainstream school with
Yeah,
extra support, can
yeah,
they
yeah, yeah. They can arrange an extra sport or extra class or something like this.
Actually, most of the down child in UK, they go to the mainstream school. Okay,
Yeah,
this is one
mostly they are.
idea. Mostly 90% students go to the
Right.
mainstream school. They do not go to the special school. Okay, this is number one. Number two is educational supervisors. They are like educational therapist. Okay, what is the role of educational therapist? They assess the every down child, even not only down child, any child where there is a concern like intellectual disability, down, any syndromic child, or any dyspraxic child, dyslexic child, any child who has a particular domain or full domain problem, they are assessed before school. The assessment name is educational therapist, and this therapist actually assess at a particular area. They will see the child, they will sit with the child, talk with the child, and they will see every action like fine motor, how the child writing, how the child reading. Because from 18 months a child can, they can open book, they can write some scribbling. So from 18 months they are doing this thing. This is the action of the educational supervisor, educational therapist. And then they are, according to their report, the child will go from 3 years to nursery school. Is it mainstream school or is it special school? It depends according to the report of that therapist. Okay, by side, down child will go to the occupational therapist, then physiotherapist, then speech and language therapist, otolaryngologist, ophthalmologist, like this. So, and this full together package will be done by the community pediatrician, not by the neurologist. Who is the head of the team member? Head of the team member is the community pediatric consultant. Okay, this is a specialized branch. So they will go, first of all, every down children, just after birth, they will be referred to the community pediatrics. And then in the community pediatrics, there is every assessment done, like speech and language, occupation, every, under these branches are under the community pediatrics. Okay. And there is one of the community pediatrics branch is educational supervisor, educational therapy. Okay. So this is how actually the education is doing, I think.
So in the multidisciplinary team management, the topmost you will tell is the community pediatrician.
Yes, yes, yes.
Then under community pediatrician, all these things will come.
All these,
Physiotherapist,
even
occupational
cardiologist.
therapist,
Yes,
speech and language therapists, and educational therapist. And apart from that, they should involve in the support groups. And if they are going to any school or nursery, the teachers and the nurses has to be involved.
yes. Also,
Okay.
if this child needed surgery, if this child needed any intervention, multidisciplinary team, that is the community pediatric team, actually they will arrange everything. Okay, this child is known by the community pediatrician, and every area in UK they have a separate community pediatric team. Like they have a separate palliative team, they have a separate social service team. These are all a team. Okay, so in a area, particular area, suppose in my area, there will be one consultant and he is responsible for all the special child. Okay, like this. Another important point in history, like when I am examining gross motor to any down child, there will be no cycle, right? So in the history taking, gross motor, I cannot ask the mother about gross motor cycle and everything. But in during examination, I have to tell the examiner that I want to explore the idea of riding tricycle or bicycle to this child. I want to explore, because tricycle or bicycle will not be present in the exam hall. Then I like to explore how the child is going upward and downward to the stair. Is it in adult manner or is it in pediatric manner or child manner? This you have to tell you the examiner, not the mother, because you cannot ask anything to the mother. And adult manner and child manner will not be understood by the mother. So you have to ask one step per stair or one foot per step. Is it upward and downward or both step? Okay, these things you have to ask in gross motor. So I think if it is a gross motor station, these questions are important for examiner. Okay, I will tell the examiner.
Hmm. And one more thing, we should all know about the role of each one of them. They may ask you, like, what is
They
the
are
role
asking,
of therapist?
not may, Dr. Noor, not they may not ask. They are asking each and everything in the exam. My friends, they have given this exam. If you will say that I will physiotherapy, what he will do? I will go for occupational therapy. What he will do? Orthotist, what he will do? They are asking each and everything.
Mm-hmm. Yes,
They,
like Dr. Ola very nicely explained about speech and language therapist. She was telling that expressive and receptive language will be improved by oromotor and lip movement and tongue movements. Parents will
yeah,
also
yeah,
be
yeah.
involved, and parents will be taught that they should repeatedly keep telling, means doing these things with the child to improve the lip movements and the oromotor movements, so that this will improve, and the swallowing will also improve like this. So we should know these roles clearly about each and every therapist in the developmental station.
In the mock video that is there in the RCPCH site, the examiner is asking the same questions, to the developmental, that mock video that is there. That what are the causes of delay and about everything. What will the speech therapist do? What will the occupational therapist do? So just
Yeah,
not
yeah, they are
knowing, we
asking.
should know it.
Yeah, yeah, yeah. They are asking each and even in the normal station, not only development, even in the normal station, if you are saying that I will do the for example, I'm saying that I will do the bone profile, like I will do the calcium or phosphate or alkaline phosphatates. So they will ask you what will happen, what will be with the calcium. I will have to tell that there will be hypocalcemia or hypercalcemia. I will have to justify my, I'm doing this, why I'm doing this, and what will happen. So
Mhm.
this is simple exam, but technical. There are so many technicalities.
Anyone can clearly tell us about the examination, how I will tell
And
examination?
one more thing I want to tell that
We can
in the
ask.
development, they are saying that when you will touch the other areas, like my exam question was to examine for gross motor and left three areas. So I should touch just for two questions, particular and main questions from each domain. Just two questions. Not should ask each and everything. They are saying that two questions are more than enough, just to justify that this is global developmental or not.
Means this is in the history.
Yeah, in the history, should
So
not ask each and everything.
so if the child is 4 years old, we'll start with what a 4-year-old child can do and then go down.
Yes, yes, just two questions from
Yes,
each
it's
domain.
right.
Yeah, yeah, yeah.
Okay. Dr. Ola. Hello, Dr. Ola.
Yes, yes.
Yeah, can you just summarize for us the case, like how we will give the summary to the examiner at the end? Like one is the history summary and the other is the clinical summary.
Yes, okay. So for the history, today I have a chance to take a history from Anna, a mother of a 4 years old girl, Lucy, which known to have Down syndrome, which diagnosed postnatally. She has the main concern of the mother about the global developmental delay in her child in all milestones, which including which I took from the history. She's delayed in the speech and language therapy, as she can mention two word sentences. She has delayed in the fine motor. She's only able to do circle scribbling. He didn't ask about the fine motor skills. Okay, and also for the socially, although she's socially interactive and happily girl, but she has some delay in toilet training, in the dressing and feeding. And medically she has hearing and the vision impairment, and no other associated complications. This girl, she's followed with the speech and language therapist and physiotherapist, dietitian, and she's involved with Down syndrome support group. So I think this is summary, but I think maybe it is okay, or it's a
Okay,
long one.
no problem. We have
She's
to
not,
continue.
yes, and she's not on the important. She's not on any medication.
Dr. Ola, rather than telling each and every, after the history summary, each and every milestone, is it fine that we just say one sentence that she has got global developmental delay? Although fine motor,
Yes, yes,
gross motor needs to be assessed so that it saves time.
yes. This one can be, yes. For the summary, we can mention this. She has a global developmental delay. And for the examination, today I assess Lucy. She's 4 years old girl. I confirm the dysmorphic features of Down syndrome. She looks small for her age, although I will take her growth parameter and plot it in a Down syndrome specific growth chart. I can see she's wearing eyeglasses but no hearing aid. I observe here during I'm taking the history, and now she's able to. I saw her. She's walking steadily, and she ran. And I want now I will proceed with the examination after washing my hand, taking permission from the Lucy and her mother. She's able to. So then I'll start. I will assess now about her forward. I will assess her now for the side walking, tandem walking, forward, backward, and it's like this one for the examination. This is the missed point for Dr. Krishna in the introduction. Okay, so for I will summarize my examination. For the by examination, for Lucy, she's 4 years old girl with the clear features of Down syndrome. She has delay in the gross motor development. I can give her a developmental age of 2.5 years to 3 years, as she able to run smoothly. She can stand on one foot temporarily for 3 seconds, for 1 second, but not for 3 seconds. And she's able to ride the stair in adult manner, and downward in childhood manner. She's unable to ride a tricycle, and she's able to throw a ball. but not a bird, and she can catch a ball, in forward only, but not out of stretch hand. This gross motor developmental delay, it's a part of a global developmental delay, which I demonstrated from the history. So she will be get benefit from the formal global developmental assessment, as well as education and the involvement of the multidisciplinary team. She will be followed with the hearing assessment, speech and language therapist, which can help in will help her in the movement of the lips, tongue, and articulation. They work together with the family about how to communicate with the child and how to deal with her, as well as if she still has feeding difficulties, they will help her in, they will assess the swallowing dysfunction by video fluoroscopy. And so also will involve other multidisciplinary team, including she's not required cardiology and endocrine, as I excluded by the history. Also, she will involve the social support group, educational and healthcare plan for decision about if she is able to join the multidisciplinary, join the mainstream school, or she required the special school with the special help. Okay, I mixed the summarization with the management. Then I will go with the management. Then maybe the examiner will ask me more question.
Okay. I think we need to practice more and more for the summary and more. Actually, in this, you will have only 4 cases. One of the 4 cases will come to you, either to examine the gross motor and take the history of the other 3 domains, or fine motor, or speech and language, and social. They are asking social also, or no?
Yes, but also
Social
they can give you 2 domain. For example, assess motor. So if they ask only assess motor, so they mean gross and fine motor.
So we will not ask questions about both gross and fine motor in history.
Yes, you will not ask.
Okay, so we'll ask only
But
about.
make sure if they mention only motor, so they meaning both gross and fine motor.
Also
And they can ask about speech and social together.
Also cognitive. In this cognitive, you have to explore fine motor, speech, and social, but very rarely 3 domain.
So for the cognitive 3, speech, fine motor, and social.
So I think we are done. Any questions before we finish this? Dr. Muzna, you're here?
Yes, I'm here. Dr. Noor, should we do the video right now, or should we put it tomorrow as the first thing? As you say.
If you are free, no problem. We can do it after 10 minutes because we need a 10 minutes break for the prayer.
Yeah.
Not we
8
can.
o'clock, I have another meeting to attend,
Hmm. So from
So we just
7:30 you can or no?
from 7:30 to 8, but will it get over? I was just wondering. The
I
topic
think
is
it will get over because it's just video, right? It will be
okay.
just you have to give the
Fine,
feedback.
fine, no issues, no issues. We
Sharp
can
7:30 we will start. Okay.
7:40 or 7:30, na?
7:30. 7:30. Now it's 7:20.
Yeah, fine.
Dr. Ola, I think you can stop this recording because now we're done with this.
Dr. Fatima, like you will start with the video now?
Not now, after 10 minutes.
After 10.